There is, of course, a concern that didn't go anywhere but also has returned manifold now. The government at the centre is on an alert mode with the COVID-19 scare in the country after the outbreak in China. Coronavirus cases are exploding in China and other East Asian countries. So the government has directed airport authorities to start random testing of 2% of the international passengers. Union Health Minister Dr. Mansukh Mandaviya on Saturday informed that the government is conducting environmental, sewage and human surveillance in view of rising COVID-19 cases globally. Health Minister further has informed that work is being done on an alert mode to control the spread of COVID-19 in India. Minister has urged people that they must continue to wear masks, avoid crowded places and follow COVID-appropriate behavior. Meanwhile, government at the centre has asked states to ensure availability of oxygen, functional life support equipment at hospitals along with holding mock drills at health facilities in view of global rise in the cases.
As we come to the end of 2022, India is once again gripped with a sense of deja vu. Amid the surge of China's COVID cases, masks and COVID norms are coming back in India. International passengers travelling to India are under surveillance.
In wake of the rising COVID-19 cases in India, the Mumbai International Airport has announced certain precautionary measures in order to keep the virus in check. A random testing of the 2% international travellers flying into Mumbai will be tested.
There was a meeting held by the Union Health Minister where there was a call to ensure checks and balances so that any kind of surge could be stopped in the country, in India, and that's the reason we've seen that from today in Delhi's international airport, random testing at the international arrival begins.
India has mandated COVID-19 negative test report for travellers arriving from China, Japan, South Korea, Hong Kong and Thailand. Passengers from these countries would be put under quarantine if they show symptoms of COVID-19 or they test positive.
चीन, जापान, दक्षिण कोरिया, सिंगापुर, बैंकॉक सभी से आने वाली फ्लाइट एयर सुविधा के माध्यम से सभी पैसेंजर को ट्रैक किया जाएगा। कोई पॉजिटिव पाया जाएगा या तो बुखार पाई जाएगी तो उसको देश में ही क्वारंटाइन करने के लिए हमने आदेश जारी कर दिया है।
The centre has rolled out SOP for oxygen plants as well. In the advisory issued to the states, centre has asked the oxygen plants to be up and running with adequate inventory of oxygen cylinders along with availability of functional life support equipments. Oxygen plants have to undergo regular mock drills and monitor daily oxygen demand and consumption. As the COVID threat looms large, states have ramped up precautionary measures.
कोरोना की चुनौतियों को लेकर के सरकार ने सभी प्रकार से सतर्कता बरतने का निर्देश दिया है।
On December 27th, hospitals across India will undergo a mock drill as well to ensure readiness of health infrastructure to fight COVID. Medical experts are stressing on genome sequencing of COVID positive samples.
एडवांस्ड मोलिकुलर पीसीआर लैब है जिसमें कि सीक्वेंसिंग होती है और ये पता लगाते हैं कि अल्फा वेरिएंट है, बीटा है, डेल्टा है, ओमिक्रॉन है या ओमिक्रॉन का कौन सा सब वेरिएंट है।
Former ICMR scientist Dr. Raman Gangakhetkar, speaking exclusively to India Today Network, suggested stressing on precautionary measures.
I don't see any reason for us to panic. No, that's one thing which I would definitely say. With respect to China, one must understand that they lifted their zero COVID strategy too sharply. Instead of a graded kind of lifting that we did for lockdowns per se.
While Prime Minister Narendra Modi has stressed on wearing masks, they have not yet been made compulsory across the country. China's COVID mayhem has put India on alert. The centre is making all efforts to ensure hospital infrastructure and facilities are combat ready. Bureau Report, India Today.